We're going to get to the topic of our beautiful kids. Let's start to do introduction, please. This is the commission meeting for May of 2025. I'm Ruth Ann Norton. I chair the commission. I appreciate the new reappointment by Governor Moore as chair of the commission, and happy to be in this moment of challenges with amazing people. Let's start with the introduction of commissioners and then key guests that are in the room, please. Wendy, you want to take attendance here?
Sure. Adam
Skolnick with the Maryland Multi-Housing Association Commission member. Excuse me.
Allie.
I'm Allie Nestad. I'm a parent advocate commission member.
Barbara.
Hi, I'm Barbara Moore. I'm a pediatric nurse practitioner and director of the lead poisoning program at Mount Washington Pediatric Hospital, commission member.
Cliff.
Clifford Mitchell, Maryland Department of Health commission member.
Fred
Banks, program manager for the lead program at Maryland Department of the Environment.
Okay. Mangela.
Good morning. Mangela Paul from Division of Early Childhood at Maryland State Department of Education, commission member. Thank you.
Michael.
Good morning, everybody. Michael Ikniowski, representative from the Maryland chapter of the American Academy of Pediatrics.
Nadia.
Good morning, everyone. I'm sad to miss you all in person. Nadia Hutchinson, Baltimore lead-free organizer with Young Gifted and Green.
And Ruth Ann, you already introduced yourself. And I think, let's see, Susan.
Good morning, everybody. Susan Kleinhammer, Lead Tech Services, accredited risk assessor.
Okay, I think all of the commissioners that are in attendance, I think I've already called your name. If I have not called your name and you are in attendance, go ahead and unmute yourself and introduce. I think I did get everybody because we have some that are not here. Okay, yep, we're good.
And Wendy, in the room with us in the conference room, we have Jordy.
Fred Banks, program manager for MD. All right.
Young man.
Thank you for the young part. Jerry Nestat, father of Ali and interest in lead.
Paula Montgomery, MDE.
You didn't introduce earlier. Sorry about that.
Okay.
Go ahead. That's you, Laura.
Oh, sure. Laura Nugent, attorney at GHHI.
I'm Faye Hansen. I'm a new outreach and education coordinator also at GHHI.
Joining us from the federal government. So wow. For everything, Faye, that entails at this point in time. Yep.
100%. Hi, everyone. I'm Shadia Musa, outreach and education manager with Green and Healthy Homes Initiative.
Tremendous. So thank you all. I'm just going to do a little bit of an overview on a couple of things. And first want to thank Dr. Mitchell for even indulging me to have a conversation on Sunday, which we talked about a little bit of the state of what states will do in light of closures of the CDC, current closure of the CDC lead, asthma, and environmental health programs. And other cancellations that are rolling in as we speak on lots of programs around environmental health and lead and the great need that we have. I will tell you as a current, and I will check my phone, but current EPA grant maker, because they're canceling contracts a lot, and we're always conscious of that. I would tell you that as we have taken in over 700 applications for environmental quality, environmental health to give out grants over Region 3, it has been noted the number of grants that cities, states, towns, and communities are putting in to try and address lead hazards in their community. And I say this to say not only in Maryland, but in Western Maryland, on the Eastern Shore, in Baltimore, and throughout our region, communities are really grappling with issues of lead, whether it's lead in soil that has come from abandoned buildings and smelters and other issues, lead in water, lead in food sources, or lead in housing. It remains a very big present issue for people in communities, and they're looking for ways to get support and to get help. And with the big concern I have, obviously, for Maryland, and I'll really ask the departments to weigh in on this, is the threat of no funding for our surveillance system, the threat of no funding for our epidemiology, for our education, and for those things that can get us on the verge of prevention. I'm also concerned that we face potential threats of lack of funding for housing choice vouchers, for housing intervention programs that come from different agencies. In conversations this week with the Office of Children's Health Protection that came to visit from the EPA, that came to visit GHHI, the one assurance that was made is that lead remains a priority of their department. So we are anxious to work to see how that will manifest itself. But their lead strategic plan that is now being called a different name remains in its priority for EPA, we are told. So we are going to try and pursue that. We've also been told that there are efforts to move the federal lead program into the American, you'll know, Cliff, more what it is, CHA, but it's part of the Making America Healthy agenda, I think.
MAHA.
Yeah, but they're going to have an AHA department at CDC, American Health something or another, right? Agenda maybe. Yet to be seen, yet to be stood up, and yet to be restored. We have called on Congress, GHHI has called on Congress, and others are joining that through lots of different ways to hold a congressional hearing. Lead has been one of the most bipartisan, and I think the representatives from EPA, who were career EPA staff, I should say, but one of the most bipartisan issues over the last 30 years to protect our children's brain health and long-term cardiac health and hypertension and other things that come from lead exposure for both children and adults. But we are seeking a congressional hearing. And Dr. Mitchell and I talked about this a little bit, but I know that we are calling for partners to join with us so that we can bring state health leaders from all of the cognizant states that grapple with the issues of lead. We'd like all 50. All 50 states don't prioritize this or don't have the same issues. But we are going to try to bring them together in a convening online this month, because we have to start to have a strategy, not just for Maryland, but for District of Columbia, for Delaware, for Pennsylvania. People are transient, right? They're moving. But throughout the country, we've got to have a strategy on surveillance, data mapping, and other things. So I wanted to open it up to the floor on that. I know it's a non-agenda item, but I think it is so important, and it will be part of our strategic plan to be taking on this. But I didn't know if MDE has any updates for this, if Rick's on the line, if he has any updates from MDE, or Dr. Mitchell, any thoughts that you want to share about actions you think we should be taking. I think including a letter from this commission to the White House, pushing back on these cancellations. Good morning.
Good morning.
Okay,
No,
somebody
good.
can start.
I'll defer to Rick first. I'm happy to do that.
And I'm happy to see Governor Moore's signature on that letter, which I feel certain we would get. Yes, go ahead, Rick.
No, I do think we need to we do need to push on this. I think the coverage of this has been, of the gutting of the lead program at CDC in particular, has been sporadic, some really good coverage, but I think it needs to be elevated. I mean, this is a direct impact on children on these programs, and I am open to whatever, working with all of you and figuring out how best to tackle this. So I'll turn it back to
So
Cliff.
Rick, I guess I have a question, right, from where I'm sitting. And this is not a negative question, so please just really for educational. Has there been a discussion with Secretary McElwain on what the Maryland Department of the Environment, as one of the lead agencies, or at DHMH, as we want to go and push this issue and we want to be supportive together, are there actions, are there things happening at the state level that we should know about? Can we be helpful? Maryland has led the nation in good laws, in enforcement, and even then, kids get poisoned, right? And and we've got lots of issues we grapple with, but we have been the national leader on this, and I think the national voice coming out of the state of Maryland, who has grappled with the issues of Baltimore and throughout the state, and the leadership across the board that we've seen from responsible property owners, from advocates, from the rental community, from the state agencies and the legislature, right? We've been able to pull leadership forward, and I think, honestly, the nation needs it. I know this is the Maryland-led commission, but I think we have a voice and a need here to stand up for this. And while the administration has said that it will stand up for the Infrastructure and Jobs Act, which means that we probably will have some protection on maybe some of the lead and water funding, kids, the majority of kids still get poisoned by painting their houses, by soil, by spices and food. And we've gutted an FDA, we're gutting the CDC, and that will imperil Maryland children. So I really, I'd love to see what we can do as a commission to inspire action of our leaders here and be a beacon for the rest of the states around the country.
Thank you. So we have briefed the secretary on that. There may have been discussion yesterday. There was a meeting that I had to miss yesterday, and I have not been caught up. But I know Dr. Mitchell and I have discussed this separately. I think there's a desire to do something, but no game plan yet, specific game plan, I should say. But it's on the radar screen for sure. And it's something I know Dr. Banks and I have definitely talked about raising awareness and taking some action on. So, and I know, as you said, it's been a bipartisan issue in Congress. Members care a lot about lead, whether it's wherever it's coming from. Again, I think this is something we'll be discussing outside of this meeting, but
yeah, and I know
I think you're right to raise this issue, and I think more people need to.
And I think we're, this is not intending to put anyone on the spot. It's intending to say everybody's dealing with 1,000 things, right? And it's one thing it's one cut after another, after another, after another, and you can keep your head on a swivel. But I think the program is savable. I actually think the program is savable. If you've got the EPA saying it's still a leading issue for them, look, I can say two good things about the EPA right now. One, or three maybe, there's still dedicated non-political staff that have stayed in the fight at the EPA who are trying, right? Two, I will give it to the administrator that he told the White House it was not a good idea to go after the nonprofit status of nonprofits around the country. So at least slowed that effort for now. And if they're saying it's a priority, let's up on that. I will not say that we can hold them to their word, so to speak, but let's try to do that. But I do think one thing, Rick and Cliff, that I think would be helpful is if the state put out some mini short report that said, if this funding ends, if this program ends, what does the state believe will be the impact, right? What's it going to cost? What data are we going to lose? What is it going to cost Maryland's children? I mean, I think everybody here will help and think about this, but we have to elevate this. I spend sleepless nights feeling like I'm too busy, right? Sometimes of 1,000 things getting in the way. And I'm sure that's not something just for me, right? That's everybody here. But we have to elevate it before we lose the window to get this back, whether it's through the budget process that may or may not occur in Congress, whether and we have to talk to people we wouldn't normally talk to, whether it's Mike Johnson or John Thune, who runs the Senate, whoever it is, we have to talk to them because we have no chance if we don't at least put something in front of them. But I think Maryland has a leadership moment here and a governor who cares about this. So I encourage the possibility of putting something out, right?
Let me just, and I want to turn it over back to you and Dr. Mitchell, but really quickly, a couple of things. Never lost on me how important lead is to members of Congress in my 35-ish years working on the Hill and 14 with the Energy and Commerce Committee. The only time I was ever yelled at by members of my subcommittee and my committee as a whole was when I didn't put enough money in the IRA for lead in schools. Not that we didn't put, it was a mere 100. It wasn't enough. So, members do care. Two, the secretary is out raising awareness. She is doing specific media on lead, I believe this week. So she is out there raising awareness of what the state's doing, of what the federal government isn't doing, and just generally of the need and the importance of the issue. And three, if anyone hasn't seen it, and when I say it's been sporadic and it's breakthrough, we've had some great success nationally. John Oliver covered this in his show last week or the week before. I'm trying to think, it was one of the MSNBC shows has also covered this issue, but it gets wrapped up in other things. So I agree, we've got to break this out.
Right.
And I'll leave it there.
Well, I couldn't agree more. And I know that the secretary is deeply committed. It'd be great if you would share any public events that we all could support. And we will certainly, I think, all be inviting the secretary to a series of events as we get into June and celebrate our work around healthy housing as the season kicks off for reaching families. Definitely. This is not an indictment at all of MDE. This is just a call to action, Rick, for all of us. And first of all, thank you for your 35 years on, working federally on this. And we're really blessed to have you. I'm just saying, how do we inspire action here that isn't just all of us that sort of scattered to the wind doing things, big voice, big efforts. Let's elevate the secretary's megaphone, right? Let's elevate other megaphones. Cliff, I did put you on the spot, but do you want to say anything about some things you think would be helpful here?
So I have been thinking about this a lot. And I have a couple of thoughts which are not going to be conventional. Number one, this is clearly a pivot moment in many respects for children's environmental health. We have seen, and Rick and I talked about this a little bit at a meeting on PFAS. But I mention that because as we have seen such dramatic progress in lead since the early 1990s, because of the work of the chair and others here at MDE, we have clearly seen a change in where lead exposures are taking place, not to dismiss the paint issue, but simply to acknowledge that the picture of lead has changed over the decades. And it is a different problem in some respects than it was in the early 1990s. And there are a couple of points to make about that. Number one, we wouldn't know any of this without a surveillance system for children's health generally. And I say that because I think we need to think about this programmatically. What are we trying to save? It's not just about lead. Is first of all, the infrastructure for children's environmental health has gone. It is no more in the federal government. The entire National Center for Environmental Health has disappeared with the exception of the laboratory. The entire Agency for Toxic Substances and Disease Registry has disappeared. So to talk about lead in and of itself, without acknowledging that the federal government has essentially discontinued its commitment to the health of children based on environmental exposures, is to me missing the point. This is part of a larger problem. And I don't think we can or should, in my view, simply say this is about lead and restoring the lead program the way it was before. I think this is an opportunity for us, which is why I think the strategic planning process comes at such an opportune moment. But I think it is true for us for asthma, for lead, for PFAS. We need to understand, number one, we will never identify any of these problems without having a surveillance system in place to look at what the exposures are and what the outcomes are. And that has been lost in the federal government. And I will also say it's been lost in the states, or will be, because the federal government is one of the largest funders of state level surveillance systems. And it is the coordination at a federal level that makes it possible for us to understand how low-level exposures to the environment affect children. That point has been largely lost in the discussion about individual programs, but it is critically important because we do not understand and cannot count and measure. And if we can't do those things, we will never be able to have intervention programs and know whether they work. So that's point number one. Point number two is, I think that discussion ought to be happening here and here I'm speaking for myself, not for my agency, because we haven't actually had this conversation this way. There are, as the chair points out, multiple programs that have been affected by all of the changes. And we will not be able to effectively address the question of children's environmental health as a whole unless we address the problem as a whole. This is a moment, I think, for the Lead Commission to think outside of lead and to think outside of itself and to think about how the government responds to children's environmental health issues as a whole. Because the question of housing and the physical environment and how it affects children's environmental health is not lead by itself. It's not dust mites by itself. It's not chemicals by themselves. It is the totality of that, and the state should be thinking about how to approach that as a totality as well in order to be able to respond effectively to this challenge. So
I get it.
I am just saying we have a statutory responsibility, but I think we need to think outside of our own box.
All right, I'm going to play devil's advocate with you in this moment. Okay? I think with the Congress we have and the executive occupation of the presidency right now, that's a bigger, broader, long-term issue. Bigger, broader, long-term issue, important and critical. Saving the money for the lead program is a clear, distinct, winnable argument. Not that what you're saying isn't the fundamental things that need to happen. I think it's a both and. It is a both and. I like to win, as you know, and I think we can win the lead argument. And I think we can win the lead money back. which I think is urgent and immediate, and the as money back, urgent and immediate, to keep things moving as we make fundamental change. To get the current CMS, HHS, whole broad spectrum, EPA, et cetera, to make those fundamental changes, it's going to take a mighty effort, a good one, a potentially good one, if you believe that RFK Jr. wants to think upstream and all those things, right? Building on whatever environmental background that he had. I was going to say before he had some sort of, I don't know what happened, the bear in the woods or something, right? But
So Ruth Ann.
we got to narrow here to the winnable steps.
And I'm not disagreeing with you. I'm just saying, I think the argument here is on children's environmental health.
No doubt.
It's not lead qua lead. It's the health of children.
No doubt. That's a bigger, that is the big issue, right? So I also will convene, Wendy, we do need to convene, and maybe MDE and MDH are critical to this. I would like to know what the Children's Environmental Health, if there is a Children's Environmental Health Commission for the state of Maryland, or there is an environmental health or something, right?
Yeah.
There's also the Environmental Justice Commission.
Yep.
I think we ought to join with them and say, what are they doing? What are we doing? And how are those three voices being heard and directed, right? In our purview to protect children from lead poisoning, in this purview, Dr. Mitchell, I'll put you on the mantle, all praise to that and appreciate it. And that is not diminishing that, because it is the fundamental groundwork. But we have some very clear, concise things to accomplish too. And I will say, in members of Congress, keeping it clear and simple and straightforward to what they can do too. I would defer to Rick, but he's the legislative specialist there. Other thoughts on this? And if you didn't get your morning coffee, get it, because I'm ready to roll today. So, Wendy?
Yeah, so did you want me to set up, like, I know we had a
Go ahead,
meeting.
Wendy.
Can you hear me? No? Can you hear me?
We can't hear you, Wendy.
You can't hear
no.
me?
You're muted.
I can hear her.
This
is why we don't use this room.
Yeah.
anymore.
Oh, you can?
I think it's, can you hear me?
I can hear you, Rick.
Yeah.
Freddie.
Did we mute her?
No.
I think the people on Zoom can hear you, but
What's that say?
people in the
They
room.
can hear her, but we can't hear her.
Oh, it's the room again.
Okay.
Okay, if everybody can just,
Rick, we recognize we're the problem.
oh gosh, okay, guys, I'm gonna see if I can chat them real quick, or text Fred or Paula. I'll text Paula. Sorry, guys, just hold on 1 second.
Okay.
Should we call in maybe?
No idea what Wendy is saying, but sure.
Oh,
Yes.
yeah, you can
Call
probably
in.
use the phone.
Call in.
Yeah, here, wait a minute.
Got it.
We have a,
I got it.
we have a landline and. Oh, I'm
I'm gonna have to mute that one.
Yeah, okay, can you hear me? Now we can't hear you.
Yours. And
We have to mute.
Oh,
you.
no, you can mute yours. I'll unmute this. Okay, hang on. Wendy, can you hear us?
I can hear you, yes.
Great. Okay.
And you can hear me, okay.
Yep. Thank
Oh
you.
my gosh, so sorry about this. Like, guys, I don't know what's going on with this technology. Fred, it might just be an instant where you have to log out and then log back on again. We were having the same issue on the Patuxent. So I just wanted to make sure, like I heard you guys say, and we had done this in the past where the three commissions met. I think it was like a year or two ago. Do you want that to happen like maybe in the June meeting, or just?
What I would like to do in the June meeting, if it's at all possible, is invite the chairs of those commissions to come to our meeting.
Okay.
Does that make sense?
Yeah.
maybe? Okay. Are you the chair of 6 of them?
No, my deputy is the chair of the Children's Environmental Health and Protection Advisory Council.
Uh-huh.
And Camille is the chair, or was the chair, probably still is the chair of the Commission on Environmental Justice.
Great. Okay. So we would like to invite the environmental justice, the children's health, and I will take any other thoughts on we would want to do on that.
Okay.
Nadia, Ms. Hutchinson.
Yeah, I have a question. I know we're going to talk about the strategic plan a little bit later from in maybe more depth, but I was wondering if it would make sense for these other commissions to also play some level of role in our strategic plan to make sure that the strategic plans connect with the mission and like strategy of the other commissions. And I'm not sure if the other commissions are also doing a strategic planning phase right now as well.
I think we can, not a bad idea. We can table that for the strategic planning discussion for a second. I don't know what just popped up on the screen, if you could get that. But the other, so one of the things that I put on the table is this commission drafting a letter to either Secretary Kennedy or the White House, talking about the importance of restoration of these programs. Thoughts on that?
So one question, Ruth Ann. So there's the
There-
health.
that is simply not true. I know there'll be 4 questions,
No,
so.
no, but really, it stems from your point about restoration of funds, because those are
Right.
health funds, but they're also housing funds, right?
100%.
And HUD
Well,
and elsewhere.
yeah, HUD's lead program has not been hit yet,
Yes.
right?
Is the key, and that's simply saying, would that include a preventive shot across the bow related to the housing and HUD programs as well?
Yeah, I mean, it could be an entire federal, we could send this to the domestic policy advisor to the Trump White House, who actually runs all of this anyhow. And to say, whether or not we want to reference the secretary's remark that he thought it was a mistake, that, right? Because they've done nothing about it if it is a mistake. But that we see that these changes are occurring, and we are certain the administration who says they advocate for children with disabilities, right? That's the thing that I think the Trump family says is their thing. That we, why this is important, why it should be restored, etc. Right? And that it aligns to make America healthy again, or make America healthy, right? And it aligns with the, I will get from the Office of Children's Health Protection at EPA what they're calling the lead plan now. They've renamed it. She said the other day they used to call it the strategic plan, but now they're calling it something else. And like implore them on this, but I think we also have to copy the Republican senators who chair and the ranking members who chair this. And, we can do this without, we'll get guidance on how to at least express an opinion without lobbying. And, but I think we have to do something. I would like to see this commission be able to release something that we are taking this seriously on behalf of Allie's kids and every other child who's poisoned by lead or has been poisoned by lead or is at threat in this state, right? And at least think about that. So thoughts? Commissioner? Any commissioners want to comment on that?
So if I can go back just a second. So as far as concerns and impact, and it kind of dovetails on what you said, Dr. Mitchell, is that our biggest concern is the infrastructure and surveillance system. There are several states that use the health system that depend on it. CDC has been virtually
The help.
helps Healthy Homes lead poisoning surveillance system. But if the support goes away for that, many states are looking at, we've already are looking at left turns and right turns we can make to offload millions and millions of data into another system. It's not an easy process.
But where does that go, right?
Right.
What's the central repository there?
So CDC does keep those records. So like I said, we don't know what's going on there now. So we traditionally will have monthly meetings with several states on not just like user issues, but upgrades, data reports, a wealth of information that kind of helps us just deal with the differences of data and how we're collecting it. That's been gone since January. And
Hey, guys, can you hear me?
Yes,
Fred,
we can.
Fred,
Yeah.
Fred, unmute. Can you unmute
No, I had you
the
muted.
conference room?
yeah.
Yeah, Fred, and then Ruth Ann, you need to mute your phone.
Yeah, I did. I think we have to do it the other way. I am muted, so mute you. Okay, go ahead.
All right.
Okay.
Can you hear me now?
Yeah, you're good.
All right.
We missed the last part of that.
It was eloquent and great, so
So,
Fred has committed MDE to put in $25 million. So it's amazing.
This is why I never talk about.
That's right. Well, we've been reaching out with the advice of Dr. Mitchell. We have been reaching out to several of other states and just talked to Minnesota today. They are getting a significant amount of federal funds. So we're sort of on the opposite end of that. We don't get many funds from CDC, but what we do get is that support, that technology, that interface, and that platform to use helps. And like I said, if that goes away, we're going to have to pivot fast and significantly. And I know it's going to be costly because right now that's a free system. And so it's really, really helpful for a lot of states to have that support.
So that's critical, right? That's a critical infrastructure. Out of curiosity, how much money does Minnesota get from CDC that Maryland doesn't get?
A couple million. Yeah. Just this year, I think they got a couple million. So that's how they fund their program.
Okay.
And to be honest, so they're doing a little more than, not really. They're doing a little less as far as environmental investigation. They do go up to 18. So that's one of the things we talked about. But we're having some really good conversations. I think we're all learning from each other. But essentially, I think on one hand, we are in a good position just because CDC traditionally just have the money we do get from CDC, we pass it through anyway. But I don't sleep because of that, the help system. You know, if you know, we make those calls and we email them and nothing comes back. And whenever there's, a county that doesn't load in right or a data fix that has to happen, the time is quadruple because our IT system, that code belongs to CDC.
Well, it also takes away the ability of HUD to determine where they're going to grant money. Because they also are looking at that system. And so we've now removed that process. And I should tell you that 50%, it looks like, of the Office of Lead Hazard Control staff have retired, have taken early retirement, early opt-out. So it is a diminished staff. I was at a meeting at Stanford University where another member in that meeting said he was told that the Office of Lead Hazard Control was going to go away. I did email the director and now Chief Operating Officer of HUD to ask that question and did not get a response. So I think people don't know. right? They're operating in the dark here. Is there any appetite at all to do a letter, is my question. Is there any appetite to do some sort of letter to the White House, to HHS, to our congressional staff, who's going to be, of course, mostly supportive. So it's sort of like, I'm not sure what we're doing if we do that. But is there some appetite here? So I'm asking commissioners if there's an appetite to stand up here.
Sure, I think we should. It's Adam. I mean, I think there's clearly value in doing that, and is subtracting the politics, but it's impossible in this dialogue to well, did they go with? It's impossible to subtract the politics. I wonder if going to Andy Harris's staff might actually add value, considering he is a Trump guy. He is a doctor.
Yes, he's an anesthesiologist, right? Is that right? Ophthalmologist. Sorry about that.
No problem.
Okay, go ahead.
So I just wonder if, I mean, if he sees the value, maybe that's not one of the rest of our congressional delegation talking to the White House. That's somebody on his side, on Trump's side, talking to the White House.
Any thoughts on that? And my bet is that he's voted against every one of these programs, but we still need, he's an anesthesiologist. Thank you, Michael. Yeah. And if you get, if Andy Harris, you might not be able to breathe either. So that, anyhow, I appreciate that. And I think that's an and we should do that too. We should make that known. No, we are in the state. We should make that known. Other thoughts from other people? All right. Well, I can guarantee you the Green and Healthy Homes Initiative is going to do this, and I encourage members of this commission to understand our mission in protecting children and have the courage to step forward. And if you feel like that's calling you out, you bet I am.
I don't really know the process of any of this. This is not my world.
Yeah, I got it. I
But
understand.
I do think that whatever, I mean, in my world, you throw as many darts at a board as you can, and
Yep.
so maybe that is the right.
We got to throw darts, right?
Yeah.
We got to try to pop the balloon. Anyhow, we will table this, and Ellie, I appreciate that. And I understand I'm not trying to make people uncomfortable. I'm trying to have a mission and a purpose for why the legislature created us 25, 35 years ago. What we do, and being a voice. I've heard that going into the strategic planning process. We need to be a voice for Maryland's children here on this. I know everybody's working hard. I know it. I will say this, our organization will do this. I invite you to join us if we don't do it as a commission. But I will say to Rick and to Paula and to Fred that as the chair of this commission, I'm requesting to meet with the secretary to talk about this, knowing she's an ally in these efforts. And I'd like to include in that the new secretary of MDH and Jake Day. I think it's important, and I will lay my gavel down on that. So, Adam, you want to talk about legislative outcomes, please?
Sorry, I stepped away for 1 second. I mean, I guess the one bill that really, I mean, that I think everybody was focused on was House Bill 352, which was added to the BRFA, that raised the registry fees. What ended up passing, and if I missed this, somebody jump in, was Fred can jump in, was $75 paid every 2 years. And then lead freeze went up to $30.
So it was basically a $7.50 per year increase.
Yeah,
correct.
That's correct. Yeah.
Okay. Any clue how we determine $7.50 as the raise for your department after 20 years?
About 15 years. That was the negotiation or we started at 120 every 2 years.
Yep.
And we got there. And we're going to work with it. But we'll continue with another proposal next year and keep fighting to raise those fees. We're just so you guys know, we're one of the few programs in the country that has a lead registration. And it's one of the reasons why we're not dying right now, because we're not really dependent on too many federal funds. And so I think New York's going to get their rental registration.
That's right.
Up and running, I think November. Rhode Island had theirs as a result. Saying you were there.
Yep.
And Chris and a couple people from LED went up to talk about rental registration. We had a lot of questions. So there's a growing.
They have now a registry.
Yeah.
It is so far prevailing pushback from their legislature. New Jersey has one.
Yeah.
And I think Michigan is moving that direction.
Right.
So it's taking hold, but I have to say, when New York claimed that they were going to be the first registry, I did post up and put a little Maryland flag on that on LinkedIn, and I said, call Fred Banks.
That's right. That's right.
And just for history, so people know, the reason we have a Maryland lead registry is when we were negotiating the bill in 1994, a guy named Mark Sisman, who was at Enterprise Social Investment, and then went on to create the Hippodrome in Baltimore, and then went to Healthy Neighborhoods, called me and said, you should try this. And we proposed it, and it passed. So all kudos to Mark Sisman, who also helped to create the low-income housing tax credit in America. But it's a very effective tool.
Yeah. So we have some strategies on how to expand what we're doing currently. So to include possibly daycares and schools to register. Right now, I don't think we do require them to get centers to get tracking numbers, but we don't require them to register their properties. And essentially, we spend a lot of time when kids are poisoned. That's sort of a third of where the kids spend their lives, and we have to go in and check these daycare centers and schools. So it'll be critical for us to.
Yeah, Adam, it may be something we might want to propose in legislation, right? To bring in and help bring order to. And I don't know if Mangela has thoughts on this or not, but I think doing that daycare, childcare, that outside of just being the ones that are rental properties, right? Being able to have some purview over those older buildings, right?
We still need to figure out, this is way in the, we'll be talking this for 20 years, but we still have nothing on owner occupieds. And we still need to figure out a way to track that as well, in my opinion.
Yeah, I think that is I don't know if Nicola Tran is on. I didn't hear earlier that she is on, or anybody from DHCD, but I do think there was discussion at one point in time on how could we do something on it through the assessment taxation when somebody buys a property, making sure that they're getting not just the federal pamphlet at the sale, but some sort of this is pre-78 measures they've taken to reduce lead in housing. But I almost think we've got to get cooperation of realtors. We've got to get cooperation of homeowner associations across the state to do something there. We probably should be thinking about that from an education standpoint for sure. I don't know, but I agree with you 100%. I think at least, Paula, is it still true? At least half of our kids are coming from owner occupied housing, or we had gotten close to that statewide?
40.
Yeah, it's a high number. It's not quite half.
60 rental. 40.
So we're still at a 60-40.
Yeah, it's been that way, and it kind of every year it might be 2% that way.
Yeah. Okay. But it is, I mean, if 40% of the kids who are exposed, right, are getting exposed in their own home.
And we do notify owner occupiers. We do the environmental investigations. It's optional.
But MDE does environmental investigations?
Yeah, for owner occupiers.
I think nobody really knows that.
Yeah.
So something to know, right?
Yeah.
Okay, Susan?
Yeah, I'm all for, I'm in a pre-1978 house, owner occupied. Let's add them to the registration requirement. If they want public service and they want a risk assessment, just in case they want those services for their own children, then make them have to pay a registration fee.
Fred?
So,
I don't think that's what you were proposing, but.
No. My first reaction is no, just because as we prioritize things, it's just one of those things where you might have an owner is working on his house and very aware of it. It just brings in a whole nother, get the government out of my house kind of feel. And my initial instincts are like, I don't know. I mean, if that's something the public wanted, definitely. Like I said, we're a service agency. If a child is affected, we definitely go out to owner occupiers. I think that's as much as we can do. If they want it, we'll be there. But ultimately, in rental agency and rental properties, this is a person that doesn't own a property that's renting and has an expectation that the place is safe, and they don't own our property. So they're more, to me, they're sort of the focus and the spirit of the law.
The one thing that having a registration for pre-78 owner occupies is it could give us better opportunities for targeted education, et cetera.
And they can opt in. They can opt into the registration program. To be honest, we don't offer it when we go out and do the ER. For us, it's the importance to get the information to the families and let them know where the poison is coming from. So, but as far as an option, we can do a better job at marketing if they want to be a part of the program, we could do that. And hey, if 20% of the owner occupiers do it, that's 20% more. So, but yeah.
Great. Okay. Susan, go ahead.
Yeah, thank you, Ruth Ann. Just as a follow-up, I mean, whatever happened, one of the criticisms I know of owner occupants was, especially in the city, that when the city went out, if they found a hazard, it would result in a lien. Is there a way to kind of be able to, service owner occupants, but not have that crushing blow of a lien placed on their property? I mean, I think it would make people more favorable to having some kind of a risk assessment from a government agency if they weren't going to be, shot in the foot, so to speak.
Yeah, I have to deal with a matter of the EPA. Cliff, could you take the chair for a minute?
I would be delighted.
Thank you. All right.
Guys, can you hear me?
Yeah, I can't leave the room.
Yeah, no, Fred,
I can do it.
Fred, try to,
There you go. Got it.
Fred, try to unmute, see if it's working. Oh, gosh.
All right, well, the fun is over now. Can you try turning on the mics? Let's just see. Unmute us. Can you guys hear us now?
Yes. Can you hear me?
Yeah, they can always.
All right. And now
We can.
Can you hear us? Can you hear us?
Yes.
Okay.
So, yeah.
So Fred, what
what
you need to do is turn your, wait a minute. I'm trying to think. We need to hear you. And it's hard because when you guys are using a cell phone, we're not picking up clearly everybody's voice. I'm trying to figure out how to do this. So if you're using the conference room speakers, mute on your phone and then turn on
Try
unmute.
muting your phone, see if it works, Fred.
Yeah, unmute your, mute
There
your
you go.
phone.
And then turn the.
That won't work. The.
Okay. Can you hear
It's
me?
gonna keep hearing.
Yeah, it's an echo.
Oh, it's okay. It's getting the feedback because of the phone then.
Yeah.
Ah, all right. Yeah, I guess when, go back to what you were doing so that we're not having feedback. And then what I would suggest to do is just kind of put the phone in a localized space so that we can hear you more.
I don't mind going back and forth. So when somebody talks, I'll just flip back off.
Okay. Okay. That'll work. Okay.
All right.
Great.
All right. Yeah. I just want to say we have a lot of people on the line and there will be a lot of suggestions about how to fix this. Just so you will know, none of them will work. So we'll just keep on stumbling through. But it's great to see the contributions from the group and participants. It shows what people can do when they can come together. They can, it's like, how many of us would it take to screw in a light bulb?
You got Mangela had her hand.
Mangela's
did you
hands
want
up.
to comment about the fact that the Office of Child Care already does look for lead potential hazards in their licensing program?
We are looking for it, but I would like guidance. But since you said it's not going to work, I thought like, should I really have to raise my hand and contribute my thoughts or just like email it to them? Can't hear you.
Okay. We can't hear you, Fred. You got to unmute.
Oh, sorry. Mangela, I do have a question.
Yes, sir.
I know that the daycares are required to register with you guys and also required to get an inspection. Do they have to renew that registration at a certain period, or what is it a one-time off thing?
When they open the facility, they would have to have the lead risk assessment done for the properties that are built before 1978. Depending on the result, they might have to do it every 2 years, or it might become a one-time testing.
Okay, thank you.
But the follow-up question would be, when they're asked to do the lead testing, I get calls from the lead inspectors. Hey, we do not know what to do for homes that are going to start childcare because we do not have guidance. We were not trained on that. So MDE, with their expertise on where the exposures are, the location of the home, if they could give them the checklist, if they are inspecting a home that has children under 6 years old or pregnant women, what else they could test, including the outside environment, especially the homes that are closer to like gas stations, industrial areas where the exposures are greater in the environment and the soil. Lead inspectors could be trained on that. So I feel it'll be nice if they are given the checklist during the training before they are certified.
Susan, you want to respond?
Yeah, thanks, Fred. Mangela, it's a very good point. I think that even I sometimes question not only do the inspectors need to be educated, but the daycare inspectors, because the question always comes up, well, does it have to be lead-free? Can it be only risk reduction? What about the areas that the children don't have access to, like if they're doing daycare and they're doing it only in the basement? Does the second floor where the kids never go have to be part of that inspection? So on. So I think that's a very good point. I think clarity would certainly help. Normally what I say to daycare providers is you got to confirm with the daycare inspector or the person who's in charge what is actually required? Is it does it have to be lead free? Does it have to be just risk reduction, as if it was a rental property? The problem with that though is it can't result in a certificate unless the entire property is being inspected, is my point. My thought. Fred, if you have something on that, because that would be something that would need to be clarified to inspectors.
Thanks, Susan. We think that we should probably try to create a special committee for this. So Mangela, I'll reach out to you, Susan, and maybe we can pull a couple people, but I'll get with Wendy and maybe we can send an email out to see who wants to be involved. If that works for everybody.
Yeah, and as we work toward a June date for the strategic plan, it'd be great if you met coming into that with some substance of value, which I'm positive we would get, but coming in to think about that as we put the agenda together.
Hey, Mangela, could you when we do send this meeting out, could you add somebody maybe from K through 12?
Yes, we could.
Oh, hold on.
Yes, will do.
Okay. All right,
Yeah, we're good.
let's go. So we have, I'm just taking back what we are, so that is, we kind of, Adam, anything else on legislation to report?
No, ma'am.
All right. So, because you have that on when you have your phone on. So if you mute that and keep your phone, right, it works, or?
Okay.
Okay, we can't hear you, guys. Can you hear us? Uh-oh.
Go ahead. Go ahead. You can.
Can you hear us
Okay.
now?
Yeah, we can hear you now.
Okay, we will all shout. It's our new strategy. I want to thank Nadia and Cliff especially for trying to advance our strategic planning process for June that we are looking at. Cliff, do you want to kind of give a synopsis, or Nadia, of where we are at this point?
I would absolutely defer to Nadia.
Thanks for shouting.
We can hear you on this side as well. So
We can hear you on this side.
Yeah, I don't think we need the phone on.
No, we're listening. We're listening to you guys through Fred's phone. So don't mute the phone.
Yes.
Because what is happening is the conference speakers, I guess, are muted. So that's how we're listening to you guys. And I guess that's how you're listening to us. But I guess what I would suggest is just passing around the phone to whomever is speaking. That would probably be helpful, that everybody can hear clearly. And that way you don't have to shout.
And we've got the candles ready when the lights go out too. And battery.
perfect.
I mean, it's very, good for the environment, right? Nadia, in all seriousness, what a great partner you've been in trying to get this moving. Do you want to give a quick update as to where we are on?
Yes. So I think that right now, kind of key juncture that we're at is finalizing the date for the strategy the strategy session rather. I'm hoping for sometime in mid-June, likely, given folks' schedules. Hoping that we'll get a scheduling link sometime this week out if possible. And then from there, hoping we can work to finalize our facilitator.
Yeah, I have actually, Nadia and Cliff to know, I've assigned that to Becca Jackson, so it could be fully focused on. To do that, Becca should be working with you and Cliff today on getting that and to the committee here. I know that we're going to be, it's the third week in June is what we're looking at, just because of conferences, schedules, and everything else. We are asking everyone to try and to be there. We will soon also go into discussions on facilitator. And we want to have by beginning of June a planning meeting packet of materials, background on where we are. So I have asked a number of our policy staff to do an update to asset and gap analysis. So we have that. We'd like the state to do as much as it can prior to the 1st of June to just give us the state of things, even if it's a 2-page memo of here's what each agency does on lead. Here's the processes. And we learned today a little bit more about homeowners being able to get things done. Nadia, we have talked about this pre-education packet. I think we also want to add any national best practices. Are there other things from this committee or group that you would like to see to ensure? I think issues around childcare are things we're going to be looking at. Issues around how we look at the contractor community for sure. And I think the Barclay case and the emerging strategy on 2,000 families, and I'll let MDE announce training. Obviously, the role of the public, education, advocacy, and engagement, a big piece of this. But given the state of things, are there other key things? Cliff, you want to talk about for us covering? I know we want to come out with really 3 to 5 concrete goals per year for this group to be contributing to the state, other than just signing a report about the work that MDE does, which thank you, MDE, for your work. But what is the contribution that all of you lovely unpaid volunteers we're making in taking on the time and the value of your time in this role? So Cliff, anything else to add?
So the only thing I would add is, I think there's an important equity question built into this discussion, because we have really focused through universal testing on identifying every child with lead exposure and assessing and evaluating that child regardless of their level of exposure. And the question, I think there's a real question about, is that appropriate? Should we be focusing more on certain populations, groups, locations, et cetera, that have higher exposures or who are more vulnerable? I think that there is a legitimate question for the state about how to prioritize. And that is a complicated question, because both for MDE and MDH, we have really addressed every single child and tried to do that regardless. But we know that there are some communities, there are some children that are more at risk. We know that that getting those additional children in certain areas is frankly more difficult, more expensive, and more complicated than in other areas. All of those, I think, are important questions that the public, the state, the community, and communities should weigh in on, because I think it's not straightforward.
I agree. Any thoughts on that from anyone?
So my only concern is that, and we're looking at the data to see if it leads us to whether those 3.5s for, once again, when I talked to Minnesota today, they aren't going out to do environmental investigations on 3.5s.
Right.
They got a higher actual level. They do notify the parents. They give them some educational information. And the question I asked was, well, if we did nothing, does a 3.5 turn into a 5? Does a 5 turn into a 10? And then if we did education, does that 3.5 turn into a 5? And then so So based on each action that we do,
Evaluating that
Right,
education. I think
right,
it's,
so-
it really does need to be done, right? And I honestly, I just met with a woman by the name of Isabel Shargo on her staff for about an hour yesterday, saying the same thing about how do we evaluate, no pressure here, our education efforts, right, on these very things, like, and how do we make that really quantifiable? I think over time, there's really no doubt that our early intervention on education saves lives, literally, of in terms of the impact here. But I do think we need to have a way of thinking about that, right?
Right.
The troubling thing is, right, to have, who are the comparative groups? We don't want there to be comparative groups to study against. We are the state.
Right.
Where literally I sat in a meeting at Stanford University and somebody defended the Kennedy Krieger lead studies. And I shook my head so badly, has published a book, and in the book defends the Kennedy Krieger lead studies. I don't even think Kennedy Krieger or Hopkins defend those studies.
Right.
The reality is we've got to, know that what we have to do on early intervention. Education is the thing, right? Education and cleanup of exposure, stopping exposure and knowing how to be aware of exposure. And I think probably where we fail a lot are in homeowner occupied properties, by the way, of people who don't get education or don't get that, but also getting more into tenants' hands, because we have very good and responsible landlords, but they're not going through the details of the exposure awareness early. So agree with that. I can't see anybody else on the screen. I can't see Nadia to know here, but we are going to be looking, it looks close to the last week in June, just looking at preliminary data that we've done with people working on the committee on input. But somewhere between the 16th and the end of the year, where you will get a email out we'll have a doodle poll out today to ensure that we can look at that. I know, Nadia, you're not available the 26th, 27th, something like that. So we'll take those days. We want to make sure you're there. Barbara, you've been on this commission for a long time. What would be key to you to come out of the meeting to make it feel valuable?
A lot of the same things that have been discussed. As always, we're concerned that are the interventions that are being provided producing the outcomes that we need so that we don't waste resources as well. Over the years, we used to have our standard rate 10 micrograms, and that's when we would discharge, when we would have 2 levels less than that. Then it went down to 5, which is what we stuck at, but which we have been getting referrals for children with levels 3.5 to 5. And question is the education that's provided from MDE and the health department adequate so they don't need to really be coming to a specialty clinic as well, and the primary care provider can just follow up. So looking at actions that we're doing and what the outcomes are, I would support continuing universal testing. I think that is beneficial for everyone across the board. And no, I'd be interested to know what other states are doing. And what the national best practices are. And back to the letter for support in the beginning, I feel like we do need to take a stand. I'm not knowledgeable enough to know what the best course of action is or to whom that information should be sent or how to go about it. So if we...
And Barbara, I
strategic meeting, making sure we came up with something strong to fight for the children of the state.
Yeah, and I understand that, and I understand I came in with loaded to bear on whatever the terminology is, right? Loaded for bear, is that right?
Yeah.
But I just want to inspire people to be thinking about it. We'll do the traditional things, right? We're going to do all the traditional things we do. I'm talking to our comms team about getting outside help to do Capitol Hill press conferences and press conferences in front of HHS and everywhere else. There's clergy doing things on the Hill, etc. This ought to be something everybody cares about. I think we can all unite in this country around the health of children. Let's start there. But thank you for that comment, and I get it and understand. Barbara, just for people on this call understand too, right? Mount Washington Pediatric is our lead specialty care hospital on addressing issues of lead exposure. What is it that you can actually do at 3.5 to 5 that is different than what a pediatrician could do, or our education team could do, or MDE could do?
Nothing really. It's just, I think, reassuring families that they are doing the right thing and assuring that the follow-up lead levels are obtained. Unfortunately, we make the same referrals and communicate and serve as the liaison sometimes for the family between them and the health department, or them and MDE if anything else is needed.
Yeah, it's that
ensure that follow-up is done.
It's that action on notices of defect. It's that action that's happening with like Young Gifted and Green on the door knocking and other community efforts being done by many great folks, and making sure that there's accountability on, and people have access to know what resources are there.
And we do a developmental screen for every clinic appointment. So if we have any concerns at any point, we assist the family for getting early intervention services.
And are those developmental screens, they're also done in the education system, right?
So if we do a developmental screen, then, and we have any concerns, we talk with the family about a referral, depending on the age of the child, infants and toddlers, or help to get them into a Head Start program, or a referral for a more intense, say, speech evaluation to determine what services might be needed.
Head Start, by the way, is on the chopping block.
I know.
Red has been an enormous source of getting kids tested early in this country. Dr. Mike.
Yes, thanks. I would just reiterate what Barbara just said about universal testing. That really is the key to identifying sources of lead. The recent food contamination from lead-tainted cinnamon would not have been detected without universal testing, because a lot of the kids who had it lived in housing that was not pre-78. So I think that's far and away a very important thing to do. And what Barbara said about infants and toddlers, child find, pediatricians make those referrals when they identify a child with an elevated lead level, and continuing to work to get the level down till you get as close to zero as possible is the ultimate goal. So I would, just kind of second everything that Barbara said about universal testing, early intervention. These are the tools that we have to try to optimize the kids who have been exposed to lead and poisoned by lead.
Agree. Who do we have in what order, Wendy?
Yeah, we have Barbara Moore. Her hand is raised, and then we'll go to Mangela and then Nadia.
Thank you.
One other.
Okay. And then we have a hand raised in the room in a minute. Yes, sir. Go ahead.
Okay, sorry. One other patient population that we've been seeing an increase in number are immigrant families. Mm-hmm. And I think one thing to address is what support services are available for them. Many of them weren't because they were in an environment with lead paint, but the spices that were there in the home that they were using, whether they brought with them from their country or found here in an international market. But just in general, the fear that is among a lot of them, the fear of being deported and what's going to happen with their children. And just what services are there? So we can prevent them from being exposed to lead by just not following through on things. So.
Okay, Mangela.
The Office of Child Care, we just included it in our FOMR that the child care providers, they need to distribute the infant and toddlers brochure annually to all families for children under 3 years old, and also to refer to have conversation with the parents if the providers find them with behavioral or developmental challenges, and to refer them to infant and toddlers and provide needed assistance to the families to help them with the follow-up appointments. So I think this is a significant advancement the Office of Child Care has undertaken, imposing this regulation on the child care providers, distributing the infant and toddlers brochure, letting them know that, hey, this service is available. And if the pediatricians are not providing the referrals, you can help this family. So have that conversation, provide them the brochure, and help them with the coordination of services. And it has to be documented that they have provided the brochures, and the licensing specialist, when they go for the inspection, they will be monitoring the proof that the childcare providers have issued these brochures. So I thought this is really something, in addition to enforcement with the blood testing and the environmental testing, connecting them to infant and toddlers probe services is something really significant. The Office of Child Care with MSD has taken a step forward.
Well, I mean, this is a good recommendation that we ought to have on how we get referral sources, connections stronger in the state, stronger between private and public sector, for sure. Do you have a hand up down there?
I do not.
Okay, I saw a lean in, so I didn't know. Out of the corner of my eye. Ms. Hutchinson.
Yeah, I was just gonna ask that if any folks want to talk deeper about these, we will have hopefully a meeting with the facilitator before our June call, and so it'd be great if anyone else from the commission wants to join our strategy working group.
I think as soon as we can get this facilitator underway, I think Nadia, I had a couple of thoughts. One is maybe run 1 or 2 quick focus groups, and then if there's enough time to have individual one-on-ones for those who want to do that as well.
That'd be great. I'd be happy to support with coordinating any of the focus groups or one-on-ones. That's an awesome idea.
Yeah, we got to get a date in order to get a facilitator, because that's the first thing they're going to ask. So we have to get that act together and get that done. Otherwise, we're going to have you locked in a room on July 4th without hot dogs or fireworks or vegan dogs. Okay.
We got another hand.
Another hand. Yes, Doctor.
Obviously, I'm interested in what's going on.
Would you reintroduce yourself to the folks?
Jerry Nestat, just a guest, father of it, or grandfather of a toxic child. I was wondering, you mentioned that there's hard.
Wait, can I be corrected?
Not a toxic child, not a
toxic exposure.
Yes.
Okay. I thought Mom might be having a heart attack over here.
Right,
He's
right.
a fabulous child.
Thank you. Thank you. I appreciate that, and I hope it doesn't appear on the record.
We have struck that from the record.
Despite my ignorance, I'd just like to ask if nothing can be really achieved, as Barbara said, for the under 5 milligram. What about, is retesting done, and can it be obligatory? The universal is fantastic.
So I will just say, all clinicians in the state have been directed to retest according to the CDC schedule. So depending upon the level, the initial level, that is a confirmed level, they are supposed to test anywhere from a month to 3 months afterwards to ensure, and the requirement from both the Department of Health and the Department of the Environment is that they should have 2 tests that are under 3.5 in order to be released from case management.
Fantastic. Thank you. I was unaware of that. But with respect to learning how effective education is, how effective other procedures have now sample that you can use for comparison.
We have that. Thank you, Adam.
Cliff, can you or Fred, can you walk through what the real functional definition of universal testing is?
So, Adam, the functional definition is as follows. Prior to 2016, all children on Medicaid were required to be tested at their 12-month visit and their 24-month visit. In addition, all children who lived in the so-called target zones, which were mainly the large cities, with a couple of exceptions, were also required if they lived in zip codes that were either Baltimore, Cumberland, all of the older cities. In 2016, the Department of Health, which owns the regulations for testing, redefined the area in in which children had to be tested as the entire state of Maryland, meaning that all children, regardless of where they live, have to be tested at their 12-month visit and their 24-month visit.
Thank you.
Oh, and sorry, one other thing. If they have not been tested before their 6th birthday, before 72 months of age, they have to have at least one test prior to their 72-month, 6-year birthday. And that's a requirement that is basically enforced by virtue of the fact that in order to enter a licensed daycare program, pre-kindergarten, kindergarten, or 1st grade, they must show that they have had that test or be exempted by their providers ascertained on Form 4620, available in English and Spanish. God, do I sound like a bureaucrat?
Susan, thank you. And I look forward to going to some child's 72-month birthday. I mean, you know, it's by the 72 instead of the 6.
Yeah.
Yes.
Syringe. Syringe.
Cliff is walking around ready to poke him.
Not gonna lie, that sounds like myself.
Okay, who did we have next? Wendy, we're losing our minds here, sorry.
Susan has her hand raised.
Okay, thank you. And then we are gonna bring this to conclusion and go to announcements. I promised a shorter meeting today, which I didn't achieve, I think, but we'll go to announcements after that and open comment. Yes, ma'am.
Cliff, the one gap I see, and maybe it isn't a gap just in my mind, which is very possible. If a child has had a blood test at 1 and 2, and then there's not an issue, and then they go into school at 6, do those blood tests for the 1 and 2 satisfy the requirement of a licensed school? Or is it required that it be done again? And because that gap is pretty huge from 2 to 6.
It is. Under the regulations, however, you only have to indicate that you have had at least 1 blood test. So that is the criterion. So if you've had your tests as required at 12 months and 24 months, that would suffice for your being able to submit a Form 4620 to your provider, your licensed daycare provider, et cetera, or kindergarten or pre-K or 1st grade. That would suffice. So you don't need another test. You just have to have 1 test documented.
Right.
Okay. Susan, then answer.
Oh, sorry. No, well, my concern is that we might be losing elevations from 2 to 4, especially if there's been a change in residency.
100%.
So I
And it ought to
will,
be part of an education campaign.
I will agree, and I will speak here on behalf of the pediatricians of the state in the following sense. When we increased the testing in 2016, one of the things that we saw overall was a 12% increase in tests conducted across the state. Significantly, however, we did not see a 12% increase in the number of kids with elevated blood lead levels. In fact, we didn't see any change at all in the number of kids with elevated blood lead levels, which suggests very much that pediatricians are in fact testing the kids that they consider to be at highest risk disproportionately, which is good. And they are recognizing clinically kids who are at risk and testing those kids. Now, that doesn't mean whether they are catching every single child, but in general, they are doing a pretty good job by those data.
Thank you.
Dr. Igniowski had a comment in the chat, I believe.
Yeah, he says the developmental impact is greater at younger ages.
And yes, that is true.
Oh, he also has finger stick lead testing will help to expand screening. Lab-based testing is necessary for follow-up of elevated levels.
Yeah, and that is also true. In 2014 and 15, we increased accessibility to finger stick testing in the office.
Right, and finger stick testing in the office resulted in a huge increase in the number of kids that were able to be screened. It's simpler, it's well tolerated by the kids, well accepted by the parents, and doesn't involve a separate trip to a laboratory to have the blood drawn. So for screening purposes, the finger stick test is a godsend. Expanding that to practices or clinics that do not have it is one way to increase screening in the state. So, the funding for that would be something to consider. Before all the changes in the current federal administration, there was reimbursement through Medicaid for testing, for drawing the specimens, so that at some point the presence of being able to do finger sticks in an office was financially viable and could, pay for itself eventually. So, economically that would work. Again, it depends on what kind of reimbursement will happen going forward, but that does increase the screening quite a bit. And my second comment about the developmental impact, it's not insignificant at age 5 and 6, certainly, but for a 1-year-old whose brain is at a much earlier state of development, anything that impairs it at that stage is going to have a greater degree of impact than a child who's already, learned to walk and talk and has his speech much more developed at age 5 or 6. So again, it's not irrelevant, the levels at 5 or 6 by any means, but testing at age 1 and 2 will certainly have the greatest developmental impact for screening purposes.
I will post this and maybe something that we want to talk about at a later time, but the Journal of American Medicine published an article within the last 6 months or so, attributing 5.5 million deaths to cardiac arrest from lead exposure as the primary cause, which means we're missing a lot on adolescents and adults, right? I think at some point in time we'll invite somebody to come and talk about that, whether that's coming from initial childhood exposure or coming from exposure accumulated as adults, right? The other thing that Ellen Silvergill talked so much about when we were writing one of the strategic planning processes that we had a 5-day strategic planning process that people may or may not recall at Mount Washington Conference Center. Something I'd love to have the luxury to do again. But she came and talked about hypertension, especially in the Black community in Baltimore and in Maryland, coming from exposure to lead and having impairment of kidney function. And that it was an overlooked aspect of hypertension, which does lead to other things, right? High blood pressure and cardiac issues. So I do think we have to be thinking here in all of this as we think about environmental health, and we think broadly. We are missing thousands of people, right, on an annual basis from adults. Yes, ma'am.
I will say my son goes to school and I've spoken to the nurse there, and she says that many of the kids have not been tested, and the youngest they can be is 18 months. So, and I know I've spoken to my friends and their kids haven't been finger pricked. And so I agree with Dr. Kanowski, getting them to.
How do you think we can inspire that to happen? Because parents have to also want to do it.
Yeah, no, and I know I've advocated to my friends before my son was before his first blood test. I didn't really know anything about it, so I don't know if maybe it's something that
Fred, can you guys hear us? Hello? We lost you guys. We can't hear you. Hello? Uh-oh. Okay. Hello?
We hear you, Wendy. We don't hear them.
Yeah, I know. I'm trying to get their attention. Let me see if I can pin the screen. Oh, gosh. All right. Let's see if I can. Okay. Anybody there?
Wendy,
Okay.
you hear it?
I got
Okay.
it. My bad.
Okay. There you go. You're good.
You know, somewhere after the first trimester, I've always said after people have to get over the shock of having a baby, but before they deliver, can there not be something in curriculum there too?
I wonder if it's something that could be at the only time the mom gets checked at her 6-week appointment. Maybe that is something that can be brought up, because I know that appointment, I've been through it. It's literally like a 5-minute appointment, but maybe just saying like, hey, this is important for you to just
know your environment. Know your
yeah.
exposures.
Because you never know. Like, we were not,
Well,
nobody
I'm
ever would have
gonna
guessed
say
that our son
something
would be.
to the lovely group of people next to me. Maybe we ought to produce a YouTube video on this and circulate it on Instagram and Blue Sky and wherever else, and YouTube. I mean, right? Brilliant. No. But let's do that. I mean, maybe you can help us with
Yeah,
it.
I am happy to
You
help
can
with
be the
anything.
advisor and former.
I don't do anything. I'm happy to help however.
Yeah, I
Which
know
is
that.
online, which is on.
But we
the
need to
website.
update it.
Yeah.
And we, but I'm saying
2025.
especially for when you learn you're pregnant, think about where you live.
Yeah.
I mean, that kind of campaign around that, not just go get, I mean, we did have a wonderful premiere party at GHHI when Alex Badakinen worked on those. So we will do another Sundance Film Festival for it. But I think this is important, right? Because even if you don't get it from your doc, we can make it available.
Yeah,
So
those
all the-
finger sticks are so easy. Like, I don't know if maybe it's something that could be done at school.
Yeah, well, we need to think about broaden those horizons. Okay, I'm gonna bring
Just
this.
as an FYI, we got about 15 minutes left.
We're going, Nadia, Cliff, any other words? I know we were talking about things.
Barb
said. We just got into a great brainstorm, before we move. What happened?
She said teens. They did a curriculum in high schools to help teens become more aware of environmental.
That was Alvin Bowles did that, right? Back in the day?
Like, I would
Anyhow,
not care. if I was 15.
there was one done by MDE, and I think Alvin Bowles, who was head of the program, was a big advocate for the high school curriculum. So whoever did it, we should pick that up too.
Dr. Kanowski said universal lead screening when you're pregnant.
Yes.
That would be great, but I've had parents when I've encouraged them to get it, and their obstetricians have actually argued with them saying it wasn't necessary.
It may not, I
had
get
that conversation.
but the amount of awareness that it would drive if it became part of that, amazing. Nadia, did you have any last words before we get moving? Okay, great. All right. We're gonna run through updates here. I'm gonna start at the bottom of the list and go up. GHHI updates.
So we had a phenomenal Healthy Homes Tour month where we visited about 6 locations. Some of those were Head Start, as well as schools, in which we provided robust tenant-based lead education to over 100 families. It was incredibly successful, and I really have to give props to Laura Nugent for leading that effort with me. It was a lot of work, but it was really great. And it really hones in on this point that education is so impactful and important. To see someone shift within those sessions, like from beginning to end of their awareness and knowledge now was really beautiful to see. So we're really happy about that. And of course, got to bring up the Asthma Summit. May is Asthma Awareness Month. This is the first day of May. So we will also be pushing into schools this month to do a similar kind of presentation with families and with children about the importance of asthma care management and asthma awareness. On top of that, our Asthma Summit again is May 20th at Morgan State University. We have now
Go Bears.
Go Bears, 130 people signed up. So very excited for that. And that is where my brain is focused right now. So, so yeah, that's what
Other things, Laura, anything related?
Exactly events Shadi described.
Do you have other trainings coming up on law or? I know
Not
you're gonna.
at the present moment, but I think
they're in process.
yeah, they're getting scheduled.
I know we're gonna try to get back to doing announcements at the district courts and try to get that throughout the state, not just Baltimore City. But really critical that the district courts are reminded of what they can do to be included in this. And Welcome Bay, you're on day what?
Week 4.
Week 4. Okay, all right. That would be 20, maybe 28 days. Okay. YGG.
Yeah, we are currently in our canvassing or back into canvassing. We'll be in the Sandtown Winchester area for the month of May. Also, as we're doing canvassing, making sure we're targeting homes that are on the lead paint violations list, because there are a few homes, especially in Sandtown Winchester. Sandtown Winchester has the highest density of homes that have active lead paint violations. Some homes have been on the violations list for many years, actually. So would love to at some point talk about the lead paint violations list. This is on the housing department's, Baltimore City Housing Department's website, and how we can get homes off of the lead paint violations list, and what actions landlords currently have, whether they're getting fined or what that process looks like, to make it so that homes come off that list quicker.
Nadia, that is a good point. That let's invite Baltimore City to describe their lead violation list, what the current process is and what they do and what will clear that. And I think that as a baseline, we can get that.
We have a question.
Go ahead.
Can you hear me?
Yeah.
Okay. Jennifer Tompkins wrote, to push finger stick lead testing, will you consider sending navigators or qualified individuals to schools to complete the testing, or have more health fairs to complete the finger stick lead testing?
I think we will, Cliff, I don't know if you want to talk about who can do finger stick testing and our resources to do that.
Yeah, I will just say quickly, Baltimore City already does finger stick testing and works with schools, health fairs, etc. And thanks to Ruth Ann and the EPA, we are distributing 3 test kits to other jurisdictions across the state for the same purpose. In order to do that, you have to get a letter of waiver from the state health department because it's a clinical test. But there are also pediatric offices and hospitals and hospital systems that also use finger stick testing in conjunction with health fairs. So that is something we have encouraged everybody who has that capability to do.
So invite your local healthcare provider potentially your hospitals or your state.
Especially the hospitals or the managed care organizations.
Yep.
Are very interested in doing that.
And honestly, I would say that back in the day, right, we used to get all of the hospitals involved in community events and do it. And I think we ought to renew those requests to the Mercies and others of the world, Harriet Lane Clinic and others who have the capabilities as well. Okay, thank you, Nadia. Baltimore City Health Department, since we're talking about you, are you on the line?
No, Brianna's not and Camille's not here today.
Okay. Well, we're going to invite them to present.
Oh, wait, Nadia is here.
We're going to invite them to present for the next commission meeting. So, Nadia?
Yeah, I have just one last question. For the houses that are, and I know that a lot of this data is still being sorted, but for the houses that are on the green environmental lead fraud case, landlords have not followed up. When will those houses be getting added to the lead paint violations list?
Do it and see. Nadia, can you hear us?
It's a little quiet, but I can hear you.
Can you all hear us?
Yeah.
They can't, we. they
Yeah,
can't
we can hear
them.
you.
Fred,
Me to call?
Fred's phone died, so we're
We
trying
can
to
hear
get.
you.
Did you go as fast as I can?
Oh, I don't think that they can hear us, but we can hear
Apparently, I
them.
don't have a Google Meet.
Can you hear us?
Yes.
We can't hear you guys.
We are back. Fred's
There
phone
you go.
died. So we're back. Thank you, Nadia, for your patience. You were going to say about the larger list. I think we'll have a baseline strategy on that within about a week, because it's a 2,000 home list about how we're going to convene those families, do some public and one-on-one education. But if that's the list, but you may have been talking about the 131 that were in the complaint. I'm not sure.
Yeah, I think I was saying for the homes that are that now have active lead paint violations, if they will be getting added to the lead paint violation list that's on the city housing department's website.
I imagine that answer is yes, but let's see, Laura, I'd ask you that we follow up particularly on that. So these are the ones coming out of this Barclay who have now been violated, and let's make sure DHCD has put them on that, Jason Hessler's group. So confer on that, okay?
Okay.
All right. You look,
Wouldn't it be MD? Or, I mean,
it's a city violation
yeah,
being
it's a
put,
city
yeah.
violation list, but not all of the environmental items are located in the city.
No, but I think Nadia was asking about those particularly, yes, okay. Okay. Going on here to, do we have Baltimore Housing, Maryland Housing?
I don't think Nicole's on. Anybody else here from there?
Yes, Jonathan Riddick from
Catherine
Baltimore
Taylor's
Department.
here.
Okay, Catherine and Jonathan are here.
From Baltimore City. Go ahead, Catherine.
Hi, good morning, everybody. Not much movement, but there has been some changes for our new grant. We're officially out of negotiations, yay. So we are in our implementation phase to get that grant started and just solidifying some things within the city. And then we're also closing out our older grant. So we should be making a lot of movements for the next few months and transitioning into that new grant. And I know we did receive that list for the fraud case. I saw the 133 and the 1,000. So we are trying to create an outreach plan to also see if any of those homes would like to enroll in our program as well.
Okay, that would be wonderful. Since there is a plan on outreach to those families as well, we'd love to coordinate that. Nicole and Catherine, And I think we can all say high praise to Yolanda Brown for keeping that grant program from HUD moving. For those who don't know, Yolanda and Matt Ammon, they've kept that moving. We'd love to coordinate with you on that outreach so that when we're talking about resources with families, we are getting your applications, et cetera, in there. So the team will follow up on that. Nicole, did you want to say something? We're so glad you're here too. Nope. Okay. Got it. And then I heard Jonathan, did I hear Jonathan? Who's Jonathan with?
Yes, greetings, everyone. My name is Jonathan Riddicks from the Department of Housing and Community Development. I'm a assistant counsel, a staff attorney with Baltimore City, handling lead paint cases. But I was just doing the introduction. I don't have any information to share at this time.
Well, Jonathan, you are a gem to do that, and I cannot tell you how much we need you. And I hope you and Laura Nugent are getting to be great friends. And we'll look forward to meeting you and helping to support the good work that you do along with Jason Hessler's group there. So thank you for introducing yourself. All right, on to our next group. Shadi, who do we have? All right, thanks, Shadia. We have the Maryland Insurance Administration. And you're a handsome guy too, Jonathan. Thanks for coming online there. Maryland Insurance Administration.
So Benita's not here. Is there anybody else?
Okay. Mangela, anything you shared some great information earlier? Are you good?
Yes, ma'am. I'm good. Thank you.
All righty. Academy of Pediatrics, anything further to share?
Nothing from what's been done, but I think going forward, I'll contact the leadership of the chapter about the lead program cuts at CDC and the Health and Human Services and see what kind of ways we can raise the voice of child health care to address some of those concerns that have been raised at this meeting.
Yeah, I'm hopeful AAP nationally is doing something leaning in on this. And Michael, the next time you're having your annual AAP conference event or whatever, if you're taking the opportunity to have tables there, would be a great time to be able to get applications, resources, et cetera, for pediatricians to take back to their practices. We'd love to know about that for all of the groups here to be able to connect.
Yeah, we usually have our state chapter meeting in September. I can, and we do have different tables of information present there. So yeah, I'm sure they would love to have someone from any of the lead poisoning organizations that are part of this committee present with resources for practicing pediatricians to use. That would be great.
Thank you for that, and I encourage everybody to want to go. They have the best. They give out all of, I think it's CeraVe. You'll walk out of there with enough CeraVe for like 20 years. So good hand lotion and everything else. Dr. Mitchell.
The only thing I would say is that we are looking at what funding is going to look like next year for the home visiting program, and a lot of that is tied up with Congress and whatever Congress decides to do about Medicaid and CHIP will potentially have a significant impact on the home visiting program.
Questions on that? All right, Dr. Banks, you get to bring us home.
All right, May 29th in this very room from 4:30 to 8:30. 5:30, thanks. We'll be doing our inspector contractor form in person. We expect a large turnout, and any inspector's contract is welcome to come. A lot of enforcement actions going on. We've been boots on the ground, heading all over the state. The green environmental remaining
approximately 1,500 certificates will be invalidated, and property owners and tenants will be notified by close of next week, Friday. Yeah, I think that's it. Once again, I've been reaching out to the states, just trying to get an idea of how they're doing, how they're trying to make ends meet, and any recommendations for going to and from we've been listening to. So that's it.
Okay, we are going to conclude this. Look for a doodle poll this afternoon on the strategic planning. Look forward to getting a facilitator selected. This is the last call. If anybody has a facilitator they want to recommend as we look at those and finalize that. In your doodle poll, you'll also be asked about food preferences, et cetera, in case you have allergies and the like. And we really appreciate you all. And I just want to, again, remind us that this is such a critical moment. And we have a small window in which to push back on change instead of let change be put into cement. If we wait until the next administration comes to, quote, rescue the situation, thousands of kids, hundreds of thousands of kids will be put at risk. And we can't wait there. So thank you to everyone in everything you're doing. And I'll just renew my call here to meet with the secretaries of the 3 agencies so that we can support the actions that I know the state and the Moore administration wants to take. So thank you all. Have a good month. Move to adjourn. Second, all in favor, go to the asthma summit. Woo. All right, take care. Bye-bye.